Okay, your phone. You can't turn your phone while recording.
Oh, all good? All right. Hey, everybody. Welcome to day 2 of our series where we will be doing 14 days of trainings. Today, we're going to have another great training for you on overdose prevention. So we are going to give you a little bit of information on Naloxone, on overdoses, on stigma, a lot of different things in this great presentation by Overdose Lifeline. So we're just going to get started into it. If you have any questions or comments, you can always leave a question or a comment, and we have someone in the background who can read off any questions. If you don't have any concerns, but you just want to save this post for a later day or share it so other people can get the information, we would love that. So we'll get started with our Naloxone administration training. We always like to start off with letting everybody know that addiction is a chronic brain disease, and like other diseases, addiction should be treated medically. So just like diabetes or anything like that, we have over 43 million Americans affected. So this is broken down into the number of people who are directly, it's not going, directly affected by the number of people who actually have substance use disorder, and then people who are affected in their lives. We'll go through here a little bit on our opioid overview. So we have 3 different types of opioids: natural, semi-synthetic, and fully synthetic. 3 different families of opioids, but since they are all opioids, naloxone will work with them. But fentanyl, we do like to say, is 50 to 100 times stronger. I think we should stop and read it.
You're live, Sam.
Oh, okay. All right, Fentanyl 101. So we are going to have another training coming up about fentanyl, our fentanyl testing strips, a little bit of information on fentanyl, xylazine, and xylazine testing strips. But we have this great fact sheet that has been used in clinical settings since 1968. Illicit fentanyl is the primary driver for our overdose and our overdose health crisis today. It's cheap, it's easy to get, and it's concentrated, so a little goes a long way. It can be injected, smoked, or snorted, and there's also, it's usually white, gray, or tan, but we've been getting reports of rainbow fentanyl now. And so it's usually found in other drugs like heroin, cocaine, meth, and pressed pills. It's very rare to not find a substance that has been cut nowadays. So 6 of the 10 of the 80 million that the DEA confiscated of pressed pills did have trace amounts of lethal amount of fentanyl. So we always like to talk about reducing prescription opioid risks because these are prescriptions. So talking to your doctor about non-opioid pain management, only taking prescription medicine that's prescribed to you, don't share medications with others, take medicine as prescribed, safely store medicine, and dispose of unused or expired medicine. There's also safe disposals at most pharmacies, and also some of our police stations have safe disposals. You can always talk with your loved one or provide them with information and resources, because there's a lot of great organizations now that have information and resources concerning substance use disorder. We do have a lot of the street drugs laced with fentanyl today because of that. It's the #1 cause of accidental death among Americans ages 18 to 45. A few myths, because this has gone around on social media. You can overdose just by touching powdered fentanyl. This is false. You cannot overdose simply by touching powdered fentanyl. It must be introduced to the bloodstream or the mucous membrane. Now, the mucous membrane could be from inhaling, so we're not saying that it's like that never happens or anything, but just being very mindful not to touch your eyes or your mouth or your nose or to inhale near drugs. Dissolving the powder in liquid does not change this property either. We'll go into a little bit about stigma. So stigma is a social process linked to power and control, which leads to these stereotypes. And we can reduce stigma by talking about it, by educating other people, choosing our words carefully. And it's very important to reduce stigma because it reduces the barriers for people needing help with their mental health issues or substance misuse, and increases the use of resources available for individual and public health. So people are 7 times more likely to be interested in treatment or go to treatment in communities that have like harm reduction or talk about substance use like they're a real person. So it's very important. Another part of anti-stigma and harm reduction is making sure of our language. So we want to know that our language can either perpetuate or overcome a stereotype. So there's a nice little campaign that's called Language Matters. So it's like, say this, not that. So we want to say person with substance use disorder, not an addict, a junkie, or a druggie, person in recovery, not an ex-addict. We try to say positive or negative rather than dirty or clean, and maintained recovery rather than stayed clean. These are all things that change over time, and it can be a little bit difficult to keep up on it. But so it's just being mindful of how we talk about ourselves, and some of these things we've said for a long time, so it can be difficult to remember. How are we talking about ourselves and about others? What is harm reduction? If you've come to these trainings, you might know a little bit about harm reduction at this point, but if you don't, it is a comprehensive approach to address substance use disorders through prevention, treatment, and recovery, where individuals who use substances set their own goals. So we want to meet them where they're at. We want it to be client-centered. We want them to have autonomy. And it's really important that it's addressing these broader social and health concerns that we have. And this is rooted in public health, because it's nothing new. This has been long implemented, but because of the fact that this has to deal with addictions, there was controversy, and having that zero tolerance mentality towards drugs kind of made this treatment philosophy hard to deal with when it comes to substance use per se. So a little bit, I always love to talk about how harm reduction comes in many forms, and it's just designed to reduce the harmful consequences. So when we talk about that, we can see that it goes to a lot of different things then, because it's not just with substances. So we have sunscreen, we have bug spray, bike helmets, vaccines, we have our automotive harm reduction, which is our seatbelts, our car seats, our airbags, designated drivers. So just like all of that, we also have opioid harm reduction, which is our Naloxone, our fentanyl testing strips, our medicated assisted treatment, which actually goes by another term now, and our syringe exchange programs. So there's a lot of different ways that we can talk about harm reduction to make it a little bit more accessible. I always tell people you can meet your community where you're at, especially with Hope Alliance of NWI. We want to meet people where they're at. We're not here to force anything into your community that you're not interested in. So you want to have a say by working with these organizations that are trying to figure out what is best for our community, what are we comfortable with. So a little spectrum that we have is, like the anti-drinking and driving campaigns, all the way to abstinence and having no use of drugs or substances. So there's a lot of different ways that you can look at harm reduction, and finding, what works for you is really important. Another tool that we have for harm reduction is our fentanyl testing strips, which we'll have another video on. But this is just a tool to prevent overdoses. It allows people the autonomy. It's easy to use. It's a low-cost method in detecting fentanyl. Because fentanyl is so lethal, it's very important that we're allowing people those steps to prevent an overdose, or at least a lethal overdose. So it doesn't measure how much fentanyl is contained in a drug sample or the potency. It just can tell if there's trace amounts there. They are highly accurate when used properly, and actually some studies have shown people are 5 times more likely to change their drug behavior when they were offered fentanyl testing strips, which is really a really great study to mention. So who's at increased risk of an overdose? Someone with low tolerance, if someone's mixing drugs, the type of drug and potency, if someone's using alone, their age, physical health, if they've had a previous non-fatal overdose, old age, mode of administration, and then also stigma. So making sure that we recognize that we play a part in eliminating the shame and stigma in our communities, so that things can be a little bit easier for the people that we love in our community that still use substances. People who might still be using substances, some overdose prevention tips: not mixing their drugs. If their tolerance is lower, using slow, using less, doing a tester shot, using a different method. And then also noticing if they want to test their substances for something else in it, or testing the quality of it. We also always tell people, try never to use alone. There is a phone number that you can call so that you're not using alone, and they can send emergency services. And then the modes of administration, being aware that can change the risk of an overdose. And then always having naloxone on you. Overdose signs and symptoms: unresponsive to the sternum rub, making a fist, rubbing the knuckles along the sternum. They can't be awakened, they can't talk, pinpoint pupils, bluish lips or fingertips, cold and clammy, vomiting, gurgling, choking noises, slow breath, respiration or heartbeat, no breathing, no heartbeat, or they're unresponsive completely. Now, I always like to say that this kind of sounds like any other medical emergency, so just being aware that maybe you can't tell if this is exactly an opioid overdose or not, but we do look at the pinpoint pupils and those bluish lips or fingertips. That can be a little bit more of an indicator, but we want to immediately call 911 before we administer naloxone, because this could be any medical emergency. And even if we administer the naloxone and it isn't an opioid overdose, we won't have any effects from that. So what is naloxone? It's that opioid antagonist that reverses an overdose. The respiratory and central nervous systems are depressed, breathing slows or stops, and then the naloxone comes in and blocks the effects of the opioids and reverses that overdose, allowing this person to breathe normally and bring the central nervous system back. And so this will not get anybody high, it's not addictive, it will not harm anyone if opioids are not present. The only side effect is if opioids are present, and then it would take them out of their opioid overdose and maybe that precipitated withdrawal. So there's a few different ways that naloxone is administered: intravenous, intramuscular, intranasal. We'll be focusing on intranasal today, but there is intramuscular available, and I always like to mention that intravenous is very common. So a lot of the time, if you've had a medical emergency and you had paramedics or an ambulance, you might notice on your discharge papers that naloxone was actually administered to you because it's a medical emergency. It's just like an EpiPen or an AED or any of these other things that paramedics and emergency medical service providers use just in case of a medical emergency, because they're trying to cover all their bases. So it's not as scary as people think it is. It is regularly administered whether you are experiencing an opioid overdose or not. Some of those safety considerations that we just talked about: it's easy to administer and store, completely safe, pregnant women, children. It will not hurt someone who's overdosing, and the only effect is if the opioids are present, and it's not purposely hurting them. The only way there maybe be that withdrawal, which is uncomfortable, of course. But at the end of the day, it saves lives, and it's the same as CPR, AEDs, or EpiPens, and it just mitigates the damage caused by a negative reaction in the body. And that's how we're looking at this with the disease of addiction and using this to reduce those harmful consequences of an opioid overdose. So this naloxone is a key strategy recommended by the CDC. How do opioids work? So these are our receptors. Too many opioids bind to the receptors and slow down the central nervous system. So then what comes along is naloxone comes along, and it replaces, it's more attracted to the receptor. So it replaces the opioid on the receptor, allowing respirations to resume because of that, because it takes away that opioid overdose. Now, this might be temporary because it can return depending on the half-life of the substance. You are at risk of re-overdosing, which is why we say it's important to call 911. Naloxone laws and access: we do have a Good Samaritan law. In Indiana, it's not a perfect law, but it does protect you from civil responsibility if you are, a layperson on the street, or you're acting in Good Samaritan, good faith. So this is a really good way to protect yourself. If, say, anything happened in that situation and you did administer naloxone, there's no reason to be worried about it. And then we're always working on expanding our Good Samaritan laws. So we want them to be more effective, but I always like people to know that if you have drugs on your person or if you have a warrant, the Good Samaritan law in Indiana currently does not protect you against that. So just being a little mindful. Now, administering naloxone, I'm just going to go through these real quick because we are going to go a little bit deeper into this later. But we always want to tell people, call 911. You'll open up the packet, thumb, index finger, and middle finger all the way. You're going to make sure your fingertips touch the nose before you press the plunger. Once you press that plunger, the whole dose will go into the nose. We don't want to take it out. We don't want to tester. And then you'll put them in the recovery position. If they're lying on their back, you're going to bend the elbow, and then you're going to bend their opposite knee, and you'll use this hand, and you'll pull them over on their side with the hand and the knee, bringing them into the recovery position as shown. So it's a little bit easier way to help people to figure out how to get them in a recovery position. We always tell people, if you are familiar with rescue breathing, this is a really great opportunity to do rescue breathing. Otherwise, it does say you can put another dose in the other nostril in 2 to 3 minutes. Now, this rescue breathing is really important, and it is in our packages of Naloxone through Overdose Lifeline. So that's a great thing to look into and to learn for yourself. We also, with Hope Alliance, have CPR face shields, and the reason we have that is for this, because we do want to encourage rescue breathing. There's been a lot of studies coming out that this is very important. When the brain doesn't have oxygen for about 5 minutes, that brain damage begins to occur from an overdose. So even if we bring somebody back, they may have brain damage from that overdose if they're not receiving that oxygen to their brain. So this rescue breathing is very crucial, very important. This is a little bit more about the recovery position that you want to put them in, like I just said, with the arm and the knee. And then just knowing after the administration of Naloxone, they may begin to wake up, their pupils may get larger, their respirations may start to increase. They may be a little uncomfortable here as well. So just noticing that that's very important here to recognize as well. Some general Naloxone information that we have that most people, I like to go back a little because we do have Nalox boxes in the area. So it says don't allow Naloxone in extreme temperatures, but it's 0.01% change in the efficacy of the medication. So we want to keep we don't want to really talk too much about the extreme temperatures because we're working a different angle now. But it does not encourage people to use. It acts as a bridge. It has no effect on the person. And repeat dose can be administered. And there is that risk of re-overdosing. So that's why we want to make sure that people do call 911. So we'll go through. There is a 2-year expiration date on our Naloxone. And that is something to be aware of. So if your Naloxone is expired, you can bring it back to us. You might be able to bring it to the health department, things like that. And then we do have some frequently asked questions. I think maybe my slideshow is a little different today. Normally I would go a little bit more in depth to how to administer the Naloxone because we'd have another part about it. So just so everybody knows, when we're administering Naloxone, we want to make sure that person is lying on their back. We want to clear their airway if they have thrown up or anything like that. And you'll just slightly tilt their head back when you do administer the Naloxone. So you'll make sure that your thumb is on the plunger and your index and your middle finger are around the Naloxone. And then when you tilt their head back, you'll make sure that's firmly all the way up, and then you'll press the plunger. And then after that is when you'd either do that rescue breathing or you bring them into the recovery position and just monitor. But we always want to make sure we're calling 911 before that. So it is very simple to administer Naloxone, but the big things when we're in a time of panic or anxiety, sometimes we forget. So just remember, there's only one dose per Naloxone. So we don't want to spray it in the air. We want to make sure it's firmly into their nose, into that mucous membrane before we press the plunger. And we want to make sure we call 911, and we want to make sure that either rescue breathing or recovery position. So those are those really important things because it is simple to administer, but when we're stressed out, maybe things get a little complicated. So we do have some questions here. If you have any questions, you can leave a comment. Even if you see this later, we can try and answer it. But things are always a little bit different. We love doing these trainings in person so that we can hear what you have to say and we can have a little bit of a discussion. And you can, there's lots of questions that people have about this stuff. So if there's anything else you have, I think that's about it for today. Thank you for coming to another one of our trainings. Some pretty funny technical difficulties in the beginning. So welcome to, boots on the ground. That's what it is. So thank you for coming. We have a lot more trainings. Remember, we're going to have those fentanyl testing strips and the xylazine testing strips information. I think that'll be a great one to help talk about substance use and people having autonomy and being able to use safely. We're starting that conversation of how can we best help people that are still using substances in our community. So thank you so much for joining us. Please like, share, follow us, or leave us a comment.